If you've ever suffered from leg and back pain, you know the feeling can be very unpleasant and hard to live with. You may have numbness and weakness in the buttocks and legs. You may be feeling lower back pain, and you may have difficulty walking long distances. If you've ever had these symptoms and have had to lean over or sit down to get relief, you may have a very specific condition called lumbar spinal stenosis. But what exactly is lumbar spinal stenosis, and what can you do to treat the symptoms? We'll explain in this video.
So first, the general definition. Spinal stenosis is the narrowing of space within the spinal canal. Let's look at the anatomy of the spine, especially the lower part of the spine called the lumbar region. These large bones of the spine help to stabilize the body and support all kinds of movement. They also protect the spinal cord and spinal nerves, which run down the length of the spine and the spinal canal between the bones. Sometimes an overgrowth of bone, called an osteophyte or bone spur, forms near the edge of one of your vertebrae. Sometimes the vertebrae can become slightly misaligned. Sometimes the elements of your spinal anatomy can change or degenerate. Any of these changes can begin to fill into the space of the spinal canal, and they compress the spinal nerves. So that's why you're experiencing pain. The nerve is being compressed by the changing anatomy. This is why, for some people, if they sit down or bend over, the pain goes away. That's because you're shifting the spine and relieving some of the pressure on that nerve. Treatment options depend on a number of factors, and the degree to which those factors have escalated. Disc degeneration and mild misalignment can cause intermittent levels of pain. However, more serious symptoms, like irregular bone growth and ligament damage, can cause more intense and more prolonged pain. So the treatment options depend on the type of pain you have. The best thing to do if you have these kinds of symptoms is to go see a doctor like an orthopedist or a neurosurgeon. They'll typically evaluate you with a series of questions. They may have you do some simple physical tests to help identify the pain, and they'll usually take some x-rays. In some cases, you may also opt for an MRI or CAT scan, which can help the doctor see what's going on in your spine from a number of angles.
There are two basic treatment pathways for patients with lumbar spinal stenosis. There are conservative care methods, and there are surgical treatment options. Coming up next, Dr. Carter will outline all of these options for you.
Depending on the type and severity of your symptoms, there are a number of treatment options that anyone with leg and back pain can try. Initially, a patient may try to modify daily activities such as bending, lifting, twisting, or long periods of walking in order to avoid making the stenosis symptoms any worse. Conservative treatments may include non-steroidal anti-inflammatory drugs, or NSAIDs, like Motrin, Advil, or Aleve. Some are over-the-counter, and some may be prescribed by your doctor. In some cases, your doctor may recommend seeing a chiropractor or physical therapist, and these treatments may include exercises to help strengthen the muscles around your spine and improve flexibility, which can also alleviate some mild symptoms. In some severe cases, your doctor may recommend an epidural steroid injection, or ESI. This is a minimally invasive injection procedure that delivers medicine directly to the area where the nerve is most compressed. In some cases, this can relieve pain for a period of weeks or months. If none of the non-surgical treatment options are helping with your pain, or if the level of stenosis or degeneration is such that it demands more significant treatment, your doctor may recommend that you have surgery to relieve your symptoms. Decompression is a surgical procedure where the doctor treats the source of pain. Since the cause of stenosis is a compression of the nerve, a decompression procedure addresses exactly where the pain is originating. There are two types of decompression surgeries, indirect and direct. Indirect decompressions consist of an implant that is inserted in your back between the bones in your spine in order to off-lift the bone and other elements that are putting pressure on the nerves. This procedure is usually done for the more mild cases of spinal stenosis, as there is no bone or tissue removal in an indirect decompression procedure. For moderate to severe cases of lumbar spinal stenosis, the primary goal of decompression surgery is to take away all bone and soft tissue that are impinging on the nerves and causing the pain. Direct decompressions consist of a surgery where the doctor directly removes bone, and other tissue if necessary, that is causing the nerve compression. In some direct decompression cases, A surgeon may need to take more bone or tissue away in order to fully relieve the nerve compression, and that can potentially leave the spine unstable. Other patients may have minor misalignment in their spine, and a decompression can further compromise the spine's stability. In cases where the level of decompression may result in spinal instability, there is a new treatment option called Coflex that the doctor can implant following a direct decompression. This unique device supports the spine and keeps it stable, yet it allows your bones to move in a natural and controlled manner. The Coflex device fits in between the two lumbar bones and is inserted through a minimally invasive technique. After a rigorous clinical study and after 5 years of clinical evidence, Coflex has proven to be an excellent non-fusion option that relieves pain, provides stability, and maintains quality of life for patients who are suffering from spinal stenosis. Compared to spinal fusion, patients who get the Coflex device experience shorter surgeries, less blood loss, and require less hospital stay. In most cases, patients are up and walking the next day following a Coflex surgery. In the most severe cases, where a patient may have a higher level of instability and require a more permanent surgical solution, a doctor will likely recommend spinal fusion. Compared to Coflex surgery, this is a more permanent stabilizing treatment and requires a longer surgery and typically a longer hospital stay. During a spinal fusion, the doctor will do a direct decompression and relieve the compression by removing bone and other tissue, then fuse that bone to another bone in order to provide stability. The bones are connected using rods and pedicle screws to provide permanent support. Compared to Coflex, patients receiving spinal fusion experience more blood loss, a longer hospital stay, and more time to recover. These are the surgical options that are available today. Of course, new technologies are being developed to relieve pain and improve post-surgical outcomes. By all means, consult with a doctor about your symptoms, and you can decide on a treatment plan that works for you.
Hopefully, this video sheds some light on lumbar spinal stenosis and helps you to understand your treatment options. Remember, if any of these symptoms describe your pain, you should schedule an appointment with a doctor and get an accurate evaluation. If diagnosed early, you may be more likely to find an efficient treatment for your stenosis and get back to a life without pain. Thanks for watching.
This video discusses a specific medical condition called lumbar spinal stenosis and outlines the causes and various treatments for this condition. As a patient, there is always potential risk in having surgery or when receiving a medical device. Usually these risks are rare, and the Coflex patient labeling should be referred to for a list of all potential risks and hazards observed during the clinical study. This video is for educational purposes only and does not replace having a conversation with your doctor.